Hello, everyone, and welcome to the show. This is Evidence in the Green, Closing the Cannabis Research Gap. I'm your co-host, Lakeisha Moulton.
And I'm your other co-host, Arnell Etienne.
And in this 5-episode podcast, we'll sit down with some of the cannabis industry's leading professionals, each a subject matter expert in their own respective fields.
Over the course of this 5-episode series, we will cover topics like federal and state regulations, optimal study design, how cannabis research can translate into changes in public policy, and much more. We hope you enjoy the show.
Okay, everyone. Joining us is Dr. Suzanne Mulvehill. She's a clinical sexologist and executive director of the Female Orgasm Research Institute. Her dissertation research reveals significant findings indicating that cannabis can enhance orgasm frequency, ease, and satisfaction in women. Dr. Mulvehill has presented her research at various conferences, including the Cannabis Clinical Outcomes Research Conference and the World Conference on Sexual Medicine. So, Dr. Mulvehill, thank you so much for being here. Can you kind of share with us how's it going? And again, I wanted to have your perspective because the way you're advancing cannabis research is by petitioning the states and using their medical conditions and expanding these categories. So just share with the audience what you have going on, what it's about, and where are you?
Thank you. Thank you very much for having me on, Lakeisha. My research evaluating women who reported orgasm difficulty during partnered sex. It was specifically about using cannabis before partnered sex and women with or without cannabis before partnered sex, and whether they had difficulty or not. So 53% reported in my study that they had orgasm difficulty during partnered sex. And the largest group of them reported that they almost never orgasm without cannabis, while they almost always orgasm with it.
And I wanted to know if you'll tell the audience, how you manage to collaborate and the effectiveness of collaborating when we're dealing with health issues and using cannabis as a therapeutic.
Well, the collaboration component is essential because we're working state by state in adding petitioning the states that allow petitioning, Maryland being one of those states, petitioning the states with a volunteer from the state who lives in the state. And then we support the research. We provide the research and the guidance through the advocacy to the process of the political process. Having been an elected official myself and been involved in a lot of political leading a political action committee, for example, for a decade down here in South Florida, helping change laws. This was for farmers, actually. But helping building advocacy and teaching the people who want to step up, because it does require a step up, because essentially it's a public document. So you become public. Whoever petitions the state is, you'll read about them in Marijuana Moment, for example. I mean, they cover most of our stories. I mean, anytime I have something going on, I can write to Tom or Ben and say, listen, this is what's going on. This is what just happened in Ohio, for example. And they've been great advocates of our Marijuana Herald too. I mean, there's a number of them. But it's a state by state. We've petitioned last year was 11 states that were petitioned. 2 states approved it, Connecticut and Illinois. Actually, Illinois really technically added it to their list this year. And New Mexico also approved it at the board level. We're waiting for final approval there. And 5 states denied it, including Maryland. Maryland, Arkansas, Ohio just denied it again. Oregon is being appealed, and a lawyer there has volunteered to guide the petitioner through the appeal process. So and Michigan was just petitioned a few weeks ago by a gentleman there who volunteered. So it requires a volunteer, it requires advocacy, building, especially where there's negativity, or I would say, and let's just call it, to me, a denial is negativity. A denial is a lack of acceptance. A denial is also means we don't want to look at this. We don't want to me, it means a lot of things. I try not to put too much emphasis on the denials and instead look at how do we get this passed.
I was just going to roll into that. Even
Yeah.
you saying of the states that had denied you, what are some of the justifications or the feedback that you're getting as to why this particular condition isn't a medical qualifying condition?
So some states don't even give a reason. They just deny it. Arkansas just denied it. Maryland reviewed it, and there was no meeting. Most states have a public meeting. Maryland has a commission now that makes the decisions. Just in case you didn't know that, that's been changed from a public meeting to just a board, a group of, for what I understand, it's a group of staff who makes the decisions. They did say that there were no randomized controlled trials. Now, I don't know if Maryland requires by law that there be a randomized controlled trial. They said there were 2 studies that specifically showed, showed validation, like that this is working, right? The cannabis is working for FOD. How many do you need? Oregon, for example, said also there was no RCTs. I think Maryland also said that no societies have approved no medical societies such as the American ACOG, College of Gynecologists, Obstetricians and Gynecologists. In general, no societies approve any conditions.
Can you kind of walk us through your methodology for your study and what made these findings so groundbreaking?
So we used what's called the orgasm subscale questions of the Female Sexual Function Index. The Female Sexual Function Index is a validated survey that evaluates female sexual function, or I don't like the word dysfunction, but difficulty. I just use the word difficulty. In some cases, perhaps it should be dysfunction, but we have women as a general, we have enough labels, so we don't need another one. It was a within study design, which means we evaluated the same women with and without cannabis use before partnered sex. So within the last 30 days, they answered a question about cannabis frequency. How was your, orgasm frequency in the last 30 days with and without cannabis? Did you orgasm almost never, almost always, sometimes, most times, a few times? Orgasm ease, same, pretty much the same. Was it difficult, not difficult, very difficult, with or without cannabis? And the same thing with orgasm satisfaction. Were you satisfied, very satisfied, not satisfied, with cannabis versus without cannabis? So this within study design ended up showing that there was statistical significance for orgasm frequency, orgasm ease, and orgasm satisfaction for the 2 groups, which was women who had orgasm difficulty, of which 53% in our study had it, and all women in the study, with and without. And it was statistically significant for both groups, with orgasm difficulty, and all women, orgasm frequency, ease, and satisfaction. Now, I will say that other studies, like there's a study called Casman, the Casman study in 2020, he evaluated cannabis use and sexual function with women using the Female Sexual Function Index. Mm-hmm. And he found that there were 26% of women in his study that had sexual dysfunction that includes orgasm difficulty. It could be arousal, desire. And he found for each step up of cannabis use, each time a woman went from twice a week to 3 times a week, or once a month to twice, every time it went up a notch, female sexual dysfunction dropped by 21%. So what we are finding is that women are using it as a treatment. Mm-hmm. Whether it gets approved or not, I want it to get approved, because then there's the social acceptability. When it's listed, it's like, we accept this in society. Yeah. We recognize that women have this.
Yes.
And as long as it stays underneath the underground, and women do it are treating it themselves, it still stays in the context of the shame and keeping it hidden. And I bring it back to the veterans who who worked diligently to get PTSD approved as a condition of treatment for medical cannabis because of the stigma and the shame. And
Absolutely.
we're doing the same for women with this FOD issue.
You know, a lot of clinicians with this stigma, or they may not yet consider cannabis as a potential intervention for women's sexual health issues. What are some of the scientific evidence do you believe is most compelling for clinicians to take this cannabis, medical cannabis, as a serious treatment?
Well, I think that's a great question. And the fact that it has been approved in 2 states shows that there is scientific evidence. You know, anyone who wants to see those petitions that list all the research and answer all the questions about why it is there's, and in fact, I just submitted today another, I can't really mention it, but another journal article that I've been working on for almost a year with my research partner, Dr. Jordan Tischler, who's a Harvard doctor and cannabis specialist. He's actually with the Association of Cannabinoid Specialists. He's the president of that association. We just submitted a journal article today that kind of reviews all the cannabis and sex studies for female orgasm difficulty. And you'll see that come out in the next year, I guess. It might take a year. But there's substantial research so number one, it's the research that shows that it is a valid treatment. From the Casmond research to our research to Moser, she did research in 2019, Amanda Moser, Dr. Becky Lynn, who found that women who use cannabis more frequently report before sex or not were twice as likely to report orgasm satisfaction. 2 times. And the reason she did this research is because she's a OBGYN. So many of her clients were coming in and saying, "You're not going to believe this, doctor, but you know, when I use cannabis, I actually have a better orgasm. I mean, I feel I have more libido, I have more desire." And there is a study that shows that the states that have medical cannabis programs, people are having more sex in those states.
What steps can be taken at that policy level to allow more, say, comprehensive research on cannabis for conditions like FOD?
From a policy level, we're looking at grants, we're looking at funding, you know, getting funded. Like when the Biden administration announced a year or two, I think in the last year, about adding women's health as a major, there was nothing in there about female orgasmic disorder or difficulty. Getting it into the policy, into the opportunities to actually do research. I mean, it's hard enough to do cannabis. I've been blocked from doing research, you know, from getting funded. Down here in Florida, we tried. I mean, I've tried with my research partner to get funded to do an RCT. They say, "Oh, you need an RCT." Well, we can't get funding to do an RCT. So it's like a catch-22. You know, so there's several components. One is to free up the funding opportunities. 2 is to add FOD as a condition that needs to be evaluated as well as other female sexual issues. This isn't the only one. You know, although I will say that when women orgasm in our study, when women were able to orgasm, very few of them had other sexual issues. They just dissipated. The desire issues went away, the arousal issues. I mean, just if orgasm is kind of like the iceberg, you know, I don't want to say how would I say this, but frame it as a way of, if we can have women orgasm, we can solve other health issues along with it. That's the key, is talking about it. You know, I gave a presentation to I was a guest of honor for a Canna Curious magazine, a women's magazine for Women's Cannabis magazine down here in South Florida 2 Saturdays ago on February 8th. And, you know, the thing was about talking about your orgasms, you know, so I opened up, it was all women. And I said, you know what, for 5 minutes, I'd like for each to talk to each other about your orgasm. What's your orgasm like when you have cannabis? What's your orgasm like when you don't have cannabis? How is you know, like, let's practice talking about it and making it a coffee table topic. That it is something we talk about our tennis elbow, or we talk about if we got a sprain in our knee, you know, it needs to be talked about. And when we get it out of the dark, like you said, the healing is already beginning.
Yeah, agree. So for those in our listening audience, if they wanted to support this initiative and champion FOD in their particular state, can you share a little bit about how?
Absolutely. Well, first they can just send me an email. You can find me on Instagram, Dr. Suzanne Mulvehill. So yeah, Female Orgasm Research Institute. They can find me by looking up the nonprofit, signing up there to get their name added. There's a pop-up there to say, do you want to be updated about the research? You can go right to womenscannabisproject.org, womenscp.org.
Dr. Mulvehill, thank you so much. It's been a pleasure. It's always a pleasure.
Thank Absolutely. You. Thank you so much.
And looking forward to the next time.
Thank you. Likewise.
Well, everyone, that concludes our show for today. We hope you've enjoyed the content. I'm your co-host, Lakeisha Moulton, and we will see you guys next time. Feel free to check out the show notes and the resource links